Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. We received, shall we say, quite a few requests for comment from members of the media today, so I thought it would be easier just to talk to you all at once in this forum. If that works, I'll say a few things to begin with about the announcement by the federal government with respect to travel and other issues today, and events related to the COVID-19 pandemic. Won't be like a regular briefing, so I'll speak for members of the media for hopefully 6 to 9 minutes, and then I'll be happy to take the questions that you have. First of all, with respect to the travel guidelines by the federal government not to travel internationally for non-essential travel, as the Premier has noted in his statement, we support this effort, we support this advice, we support these guidelines, and it's pretty simple. If it's not necessary, don't go. We're seeing a very significant growth in the Omicron variant of concern across the world and in different parts of Canada. Here in British Columbia, yes, but even more so in other parts of Canada, such that, as we heard from Ontario today, there's an expectation that the Omicron variant of concern will become the dominant variant of concern in that province. And when you consider a very short time ago we had not heard of it, that tells you how quickly events have been and are moving across the country and indeed across the world. And so I think the advice by the federal government with respect to travel is timely, as the Premier has said, and it's pretty straightforward. If it isn't essential, don't go. And even though this is immensely disappointing, and I know that many people have been hoping to get a break away from British Columbia at this time of year, it's also important, and I think critical, really, to put your health, the health of the community first, and that requires, I think, taking very seriously the guidance of the federal government. I'd also note that people have to, I think, exercise the same caution in traveling across Canada. As we've noted, Quebec and Ontario, in the case of this variant, and it hasn't been always the case, but in the case of this variant, have more cases right now, and you see the growth of this variant of concern in those jurisdictions. You'll note that travel involving a rugby tournament led to the variant of concern going to different parts of the country, including British Columbia. So I think the message is, if you're not vaccinated, definitely don't travel. That health measures are changing in different jurisdictions and change today in different jurisdictions, and I would expect more change to follow in the days that come. And so whether you're traveling around the world or across Canada, this is the time to exercise caution across the board. Wanted to note that we have seen in the last couple of days larger case counts in BC. We haven't seen the same increase in hospitalization, of course, and in critical care. In fact, critical care is down today. I understand that the dashboard has been refreshed in our statement. The update or the information bulletin on cases will be out shortly. But needless to say, what we're seeing is an increase, particularly in Vancouver Coastal Health, which has seen extraordinarily low case counts relative to the population, relative to their population in recent months. Well, we've seen an increase in cases there over the last number of days. Some of this is related, as it has been at different times in the pandemic, to informal social gatherings. In other words, not organized social gatherings, but informal social gatherings. And we've seen some large clusters of cases as a result of that, and you see that reflected in the numbers in those places. With respect to public health measures, as Dr. Henry said yesterday, it is important, I think, especially in this holiday period, to exercise caution in all that we do. Medical health officers in the different health authorities have meeting with Dr. Henry today, obviously others involved in those meetings, including myself, and I would expect Dr. Henry will be reviewing and is reviewing actively any changes to public health orders that will be required in the coming days to address the increase in case counts. Again, not just related to the Omicron variant of concern. In fact, of course, the vast majority of our cases in British Columbia continue to be the Delta variant. With respect to other issues, I'd just say that our third dose immunization campaign continues to go well. I just want to give you some details about this. You'll know that we announced our third dose strategy for all British Columbians at the time over 18 and now over 12. Our strategy on October the 26th that everyone would be in line with a booster dose consistent with public health recommendations. Those recommendations were essentially supported about a month later by the National Advisory Committee on Immunization, which met this week and continues to support those timelines and those measures, the 6 months and the 8 months. And as of now, our campaign's going very well. As of yesterday, when we had one of our bigger days, so far 633,831 British Columbians have received their third dose. That represents 60% of all those over 70, 45% of all those over 65, and 14% of all those eligible British Columbians over 12. So we're making significant progress, and every effort is going to be made, and you saw that yesterday with the significant expansion of our program to pharmacies. It's happening faster than expected. 500 pharmacies by the end of this week, 1,000 in the month of January, that every effort's going to be made to ensure that booster doses are available as quickly as possible to British Columbians, consistent with public health guidelines. It's important that we follow the best advice with respect to vaccine effectiveness, and that's what we're doing, and that's what we've been doing since we laid out the policy on October 26th. I'll note the very significant success of this effort in long-term care. Today, the outbreak at Laurier Manor, which is an assisted living facility in Prince George, was declared over. That means that we are down to 2 outbreaks in healthcare facilities in the province, one at Ridge Meadows in Maple Ridge, the other at Ponderosa in Kamloops. So I think all of those are important considerations in our third dose campaign, which will continue to involve more and more people, and especially locations, including and especially pharmacies. I want to note further that with respect to rapid testing, as we noted yesterday, the British Columbia has, of course, been waiting for at-home tests, which are on-label at-home tests, which are not yet available in wide numbers in Canada. And it had been our expectation, based on the advice we received, that we'd see them in November and then December. And you'll recall the answers we gave at that time. It now appears, and so I said yesterday, that they won't be available till January, and they may not be available in the numbers that we would hope, in spite of all of the numbers announced today by the federal government. A relatively smaller subset, relatively small subset of those numbers will be take-home rapid tests. So we'll be laying out our rapid testing plan coming up next Tuesday in terms of how we intend to both use those tests and to enhance them by using other tests that can be used individually and more easily by people. Our rapid testing campaign, of course, our effort, 550,000 rapid tests used in BC, about 35,000 a day right now, is expanding. And we need to, as well, continue to review our capacity to do PCR testing, the gold standard test, which is really required to follow up from rapid testing. As you know, we've expanded our capacity of our system to do roughly 20,600 tests a day. We still have that capacity. That capacity is in place. I think yesterday the numbers, the 589 test positive numbers, is based on approximately 16,000 PCR tests that took place in British Columbia. So we're going to be specifically, there'll be significantly more access to rapid tests. We're happy that more are coming. We'll be getting our share of those in the new year as they come forward, which is approximately, when we divide things up, 13.5% of the Canadian population. And as we did with vaccination and other things, you'll see a systematic campaign effort focused on those who need it most, and to reduce transmission for those who are the most vulnerable, and to assist people in dealing with this pandemic. So you'll be seeing that shortly, action, and so that people will see action on rapid testing. You'll see soon, shortly, continued the continued efforts to use public health orders and guidance to reduce the spread of COVID-19, and again, these extraordinary efforts to vaccinate British Columbians. I want to encourage everybody, if they're asked to get vaccinated, to get vaccinated. I want to say finally that in our childhood immunization campaign, well, two more things. In our childhood immunization campaign, as of last night, 77,857 children had received their first dose immunization with the child-specific formula of the Pfizer vaccine. That's 77,857. That's 22% of all those in the category. Approximately 146,000 registrations have been received, and we encourage parents to register their children for that effort. And finally, I've just had a meeting with my federal and provincial health colleagues, and one of the questions I have asked and continue to ask is about the availability of antivirals. You'll know that there's one that's been developed by the multinational drug company Pfizer, another by the multinational drug company Merck Frost, both of those are currently under Health Canada review, but the Government of Canada has procured those drugs, which can only be used pending approval by Health Canada, by the regulatory arm of Health Canada, and we expect that to happen sometime early in the new year, and we look forward to that and hope to have that in addition to our other means of responding to the challenges of the COVID-19 pandemic. Finally, I just want to thank all of our healthcare workers today and every day for all that they're doing across British Columbia. We have over 9,200 patients in our acute care hospitals. We have a large third dose vaccination campaign, a significant childhood vaccination campaign, our ongoing vaccination campaigns, 1,600 contact tracers around the province. We're doing more PCR testing than we have ever done in BC, and we're going to continue to be there for you. But this work isn't done in the abstract. It's done by healthcare workers, healthcare professionals, and is supported by people across the province. And as always, I wish to say thank you, and I'm happy to take your questions.
Minister, a reminder to media on the line, please press *1 to enter the queue. You'll be limited to one question and one follow-up. For the first question today, we start in the room. Alan Check on behalf of CTV Vancouver. Please go ahead.
Minister Dix, what's your advice to British Columbians who are or have already planned trips outside of Canada and are now trying to figure out what to do?
Well, it's I've had the opportunity to respond to questions about this today. You can imagine, given the federal announcement, that we've received lots of questions and lots of people in those circumstances. The advice from Health Canada is very clear. If it's not essential, don't go. And, you know, right from this podium, people will recall in February and March of 2020, us discussing these very issues and the cost to many people who did go. And I don't, this is not a question of recalling or holding people accountable because the circumstances were so new at the time, but we've had this experience. And when the officials at Health Canada say, if it's not essential, don't go, then, and that's supported by public health officials everywhere, then I think that's good advice to take. And so my advice, unfortunately, is, because I know people have plans and I know it has costs for them, is that it's necessary to follow that advice. You know, we talk about these cases. We have a serious number of cases in BC today, 589, I think it is, across the province today. And in the United Kingdom, I think apples to apples, as population, they have 10 to 11 times as many cases. In France, they have 9 to 10 times as many cases. In Germany, they have 8 to 9 times as many cases. In other words, we have the same level of transmission of COVID-19 as they do in the United Kingdom, which has an advanced healthcare system and has, in the National Health Service, we would have today approximately 5,500 to 6,000 cases of COVID-19 in British Columbia today. And so one has to take that into account. And the fact that we now, for the second time, with measures. The federal government took measures a couple of weeks ago and now is taking more measures and more advice today. You can see that the situation is evolving. And we can't be certain about what the situation will be 2 weeks from now, but it's unlikely that it'll be better than it is today. So my advice is that there will be other trips, but you only have one health and one life, and your health is vitally important to that life, and so follow the advice. Thank you.
For the next question, we go to Andrea Wu, Globe and Mail.
Hi, thanks for taking my question. Regarding the dosing interval for kids 5 to 11, NACI currently recommends 8 weeks in between the first and second shots, but are parents in BC able to reduce that to, say, 3 or 4 weeks if they wanted to?
Well, right now, Andrea, we're focused on first doses. And so I wouldn't expect that to be the case, but that advice would come from Dr. Henry and her team and her immunization team and the immunization team and their recommendations. But right now, as noted, we have vaccinated 77,000 of the 349,000 eligible, or about 22%, and we'll be working through that. And this is a vaccine, of course, that has been designed for children 5 to 11. It's now we have 77,000 children vaccinated in BC. A huge number, in the hundreds of thousands across Canada, in the millions, indeed the tens of millions around the world. So this is a vaccine that's proven its safety and proven its effectiveness, not in studies, but in the real world. And I recommend everyone register. For the moment, though, I wouldn't expect a change in that guidance. But right now, what we're trying to do and what we're focused on is getting everyone their first dose, and that's going quite well. But I would say, if you look at the overall numbers, 22% vaccinated, 37% booked appointments, 42% registered, that we need to get those registrations up because, as you can see, we're rapidly closing in. I mean, we've gone from 0 to 22% pretty quickly. We're going to go to 40% very quickly, and we obviously need the registrations to continue to rise so we continue to have children to vaccinate at our vaccine centers.
Do you have a follow-up, Andrea?
Yes, thank you for that. Question from a colleague. Why is it that we don't have the same type of take-home rapid tests that other provinces are distributing, and who determines what kind of tests Ottawa sends?
Those discussions are between public health, so those are public health guidance. There are about 24 different kinds of rapid tests that are licensed in Canada. And none of the tests are on label designed as at-home tests that are available now. None of them are. Some of them have been transformed or been transformed to do that. So our public health officials, we have a committee of senior officials that gives advice on rapid testing and that guides our rapid testing policy. It's driven by science and driven by public health in BC. And it will continue to be over the next little while, and they provide advice and recommendations on what the most effective tests are, because they validate tests and they see what the most effective tests are, the most accurate tests are, and then they act accordingly. And so it's on their counsel and their advice that our decisions as to which rapid tests we have are made. We're getting, I expect, in addition to those that we have on hand that we described yesterday, an additional 200,000 in this calendar year. So for all the talk of tens of millions, that's what's coming in this calendar year. And we're looking to see how those can be used, and those that we have can be used to provide, to expand out our program. And so that's what we intend to do, but those how the decisions are made. They're made on the advice and counsel of Public Health in BC, and that approach to put the science first and to put the advice on medical matters from Public Health first has been, I think, one of our major advantages in the province.
Next question, Richard Zussman, Global News.
To that question, Andrew was asking, so Ontario, Alberta, Quebec, Nova Scotia, Saskatchewan, all handing out rapid tests. Did they order something different than us, or are they going off-label that we refuse to do? I think that's what people are confused about. Dr. Henry said yesterday, Alberta ordered these tests. They were at the front of the list. We were at the bottom. Why are we at the bottom? And on another decision in Ontario today, they're now going with 3 months between second and third doses for boosters to speed up the process for everyone 18 plus? Would BC consider shortening the gap between second and third doses to speed up boosters?
I think Dr. Henry responded to that second question yesterday, which is, first of all, we have a lot on the 6-month schedule. We have a lot of people on the cusp, the 6 to 8 month schedule on the cusp of getting third doses. That is what's best advised. That's what's recommended by the NACI, and that's what we'll do. But there are differences between BC and Ontario, Richard, that you'll know. For example, the 126,000 clinically vulnerable people who have received their booster doses in BC, that program is pretty unique in Canada to BC, that focus on them. The more than 25,000 healthcare workers who've already received their booster doses and so on. So we laid out in detail what we were going to do on booster doses before everyone else on October 26th. You'll recall there was some criticism of that because we said that everybody was going to get the booster dose in BC over a schedule that was informed by public health, and that's what we're going to do. And with respect to rapid testing, British Columbia has used rapid testing. It's been used based on the efforts of public health. It's been available for use since they were validated in British Columbia in December of 2020. We've used 555,000, I think, roughly. It'll be more today, but roughly that. We're currently using about 35,000 a week. And we'll be seeking and are seeking more rapid tests than we'll be in January. Based on what we were told in November and December, it was our expectation that take-home tests would be available, and they're not yet. I mean, ones that are designed and are on-label use of take-home tests, those would be available. They're not available yet. And so, and because of questions about when they're available, what quantity they'll be available in, because it's not just an issue, it's not really an issue of approval, it's an issue of the quantities. It is our intention to add to that by making and adjusting some of our current supply so that we'll have more and broader access to rapid testing in BC. So our process is informed by the science and was put in place on the advice of public health, and we're going to be meeting this challenge of these new circumstances with greater use of rapid tests. But there's going to be also inevitably a greater use of PCR testing and other things that we've put emphasis on more so than other jurisdictions, like contact tracing. Unlike other jurisdictions, and I was asked in a media interview about the requirement put in Ontario this week that all visitors in long-term care will be vaccinated. Well, as you know, that's been in place for some time in BC, as has been the vaccine mandate in long-term care and acute care. So there are some differences between the provinces in terms of their strategies, but we intend to, federal government announced more rapid tests today, and we intend to get our full share of those, and hopefully a significant portion of those will be take-home, because that would be the easiest, the most useful way to expand the program without utilizing public health resources that we need for other important public health things, especially COVID-19, but the public health emergency that's the overdose crisis and everything else in healthcare, and that's what we're going to do.
Richard, do you have a follow-up?
I want to ask about two types of gatherings in coastal health. First, one at Rogers Arena that happens every few nights when the Canucks play at home. Does the province have any intention to put on capacity limits like Ontario has for events like hockey games? And also, is there any concern around cases in coastal health, especially linked to people having parties or other gatherings, and what can the province do to address that situation?
Well, on the second point, yes. And what we're seeing, I think, is the transmission is not related to, has not been related largely to large organized gatherings such as hockey games, but also cultural events and others, which are organized under the auspices of the BC vaccine card. And, and the issue there is one of risk into the future if we see an increase in transmission. So all of those questions are regularly under review, but clearly under review right now. But the issue in Vancouver Coastal Health, and we've seen in Vancouver Island Health as well, is what we call unorganized events, where people come together for parties and social events, which happen frequently this time of year. And two things I'd say. One, I would expect, I think they should heed what people should heed what Dr. Henry said yesterday, which is this is the time for caution. We have a new variant of concern in the world, which is transmitting in another province, Ontario, not a small one. It's soon to become the dominant variant of concern, and people need to be extremely cautious. And my advice to you as individuals is, if you're going to an event, you don't know everyone at the event, and there isn't a vaccine mandate at the event, don't go.
Next question, we go to Rob Shaw, Check News.
Sorry, Mister, can I just can you put a sharper point on that last question from Richard? Are you considering restrictions on capacity limits for big indoor events like Ontario has announced today?
What I said very clearly, Rob, I think at the beginning, but I'm going to say it again. I'll try and put, what was the term you used, point on it? I'll try and put a point on it. Dr. Henry and regional medical officers of health are meeting actively on all these points. And obviously those issues, the issue of capacity limits, the issue of the vaccine card, the issue of, for example, of whether the vaccine card does apply under 50 as well as over 50 in terms of capacity, so to smaller events as well. Those issues are all under active consideration by public health, and we'll have more to say about that soon. So I think the pointy answer to you is yes.
Rob, do you have a follow-up?
Okay, that was good and pointy. Thank you. Just on the interval on the booster doses, when Ontario announced today that they were opening them up to everyone who's 18 years and older, is there a reason why BC can't just throw open the booster doses to anyone who wants one at this point and has reached that kind of almost 6-month mark? Do we not have enough capacity, or is the system not would it not allow it, or why can't we just follow that kind of route? Because
in general, what we try and do in BC, and I say this without judgment of what anyone else does, because everyone's dealing with their own circumstances. But in general in BC, we follow the science. So we laid out a detailed plan on October 26th about how we were going to deal with booster and third doses. And we did it before everybody else. The science suggests, and this was subsequently supported by the NACI, we said 6 to 8 months after second dose. And the NACI recommendation came in and it supported that view. And that is because of vaccine effectiveness. When the appropriate moment is to get the booster dose for your own health. And it's on that the decision has been made. And we've been doing very well. And we have made some other decisions that are different than other provinces. In particular, the 126,000 clinically extremely vulnerable people who are eligible and have received the third dose of the vaccine. I think that was the right decision. So our approach is guided, as it always has been, on where the risk is. So long-term care and assisted living. We've done all long-term care and assisted living and independent living homes, and you've seen the results, that and vaccine mandates. Clinically extremely vulnerable people, it was our view and the view of those people whose lives are devoted to studying and operationalizing this work, that we should prioritize a number of people who are clinically extremely vulnerable. It's a subset of the whole group, so it doesn't include people like me with type 1 diabetes, but it includes about 150,000 people. 126,000 of those have been vaccinated. And we're going to continue to do that, which is in small and remote Indigenous communities, some of which received the first and second doses earlier. We're doing that as well. Basically, about 6 months ago, we'd done about between 600 and 650,000 second doses, and that's how many third doses we've done. So we're on schedule, and we've just cranked up the pharmacy system with much thanks to the BC Pharmacy Association to continue to meet the tests there. So we are doing the work. And when we made the announcement, Rob, on October 26th, we expected to do, we laid out how many vaccines we do between now and the end of the year. We've done 35, we're going to do 35% more than that. So that's good, and we continue to have to do better.
Next question, Susan Lazaruk, Vancouver Sun.
Oh, hi. Thanks for taking my question. I'm just going to go back to the booster rollout. When the decision to roll out the booster was made on October 26th, Omicron wasn't the concern that it is today. So it's surging. It's coinciding with everyone gathering for holidays. What's preventing BC from rolling out the boosters at a faster rate like they're doing in Ontario and Alberta?
Well, we are. We haven't made too many announcements about it, but we are. In fact, we're doing it at a 35% faster rate, not theoretically, but actually right now. We laid out our plans. And remember, you provide booster doses to provide effective protection against COVID-19. And that is the intention of the program. That is what we're doing with the program. So the science says, not just our science, the National Advisory Committee and ourselves say, that's a 6 months interval, at least 6 month interval for those for older people, and then it's the recommendation of the NACI, I think, was closer to 8 months for younger people to maximize the effectiveness of the vaccine. And so that's the approach that Dr. Henry laid out in detail yesterday that we're following. So we are expanding capacity, right? We did an announcement at London Drugs on yesterday. We talked to the BC Pharmacy Association. We laid it out where we're dramatically expanding pharmacies. It's all in our Immunization BC network. And by January, it'll be more than 1,000 pharmacies where you're able to book your COVID-19 vaccination. Right now, it's 500. And that is a significant expansion in addition to all the work we're doing. So the short answer is we are, I think, meeting the test more than we expected to do. And we're going to continue to do that. We have an outstanding person leading our effort, Dr. Penny Ballum, and spoke to her today. And just tell you that everybody in healthcare, and it's no easy thing for community pharmacy as well, which has also rolled out 1.3 million dose flu vaccine campaign in the same period. It's a huge effort for everybody, but I think people are delivering at a very high level.
Susan, do you have a follow-up?
Yeah, so is it supply or infrastructure or staff that's impeding the rollout?
Well, first of all, we're doing 35% better than we announced we'd do on October 26th to the end of the year. That's what we're doing. So the rollout is advancing and it is being speeded up. And we're expanding the capacity of the system through community pharmacy. So that is what's happening. This is not an issue of supply. But remember, the supply of people to get their booster dose depends on the number of people who had first and second doses early in the pandemic. And we are giving priority to those who are most vulnerable. Why? Because we saw breakthrough cases in long-term care, in hospitals, breakthrough cases meaning vaccinated people who are getting ill in hospitals and in long-term care. And we gave priority to our elders. And as a result, this isn't people who might be vaccinated. This isn't an announcement of people getting vaccinated. 60% of people, all those over 70, have received their third dose immunization. And that number is obviously growing every day and will continue to grow. So the campaign's really effective, really strong. I'm really proud of our teams for delivering on it. I'm really proud of our community pharmacists who are going to add significantly to that. So this is an issue of delivering for those who are eligible, and that's what we're doing, and delivering it in a way that maximizes their protection against COVID-19. You're right, we didn't know about Omicron when we announced on October 26th, but Omicron makes what we announced and our decision to go forward on October 26th, and the way we went forward, which is addressing the most vulnerable first, it certainly supports that.
Next question, Rob Monroe, Info News.
Thank you for this, Minister. I'm just wondering, I don't seem to have heard this, the numbers for Omicron we got yesterday were apparently from Sunday. Do we have updated numbers, how many cases there are and how many are in the interior and where in the interior?
Well, I don't think we'd be that precise necessarily, but we'll have more numbers tomorrow. But I think suffice to say, I mean, Ontario, I think, suggested, and they do this through a different a slightly different and less comprehensive method of testing to estimate. I think they suggested that they had in the neighborhood of 30% of the 1,900 cases they had in Ontario, or the 1,850 cases they had in Ontario, about 30% of them were roughly 600 to 700 cases were Omicron. These were cumulative cases, so I think we announced 44 yesterday. That was cumulative, and I would expect that number will grow in the next couple of days, and we'll have numbers by health authorities for you tomorrow.
Bob, do you have a follow-up?
No, that's fine.
Thank you. Next question, Moira Whiten, the Tyee.
Hi, thank you for taking my question. Following up on the numbers of Omicron in the province right now, can you give us a better picture of what the actual lag in reporting is? Given that the most recent number was 44 confirmed as of December 12th, is that cases from samples up until December 12th that have been confirmed in the days since, or is that cases that have been sequenced and confirmed up until December 12th? I'm just trying to get a sense of how long the genomic sequencing process takes from the moment of a positive test and, where we might be in that trajectory with that lag in data.
I don't think it's a lag. Here's what's happened. Everybody who tests positive for COVID-19 right now, every test of a case tests positive, goes through the whole genomic sequencing process now, every case. So in every one of those cases, they've tested positive for COVID-19. The only remaining question is whether it's the Delta variant of concern, which is still the overwhelming number in the province, virtually 100% or close to 100% of variants concerns identified you saw in the modeling yesterday. The only question is everyone has to do what they have to do when you get diagnosed with COVID-19 in terms of isolation. So everyone knows that. And then all of them go through, everyone in BC, and no province, none in Canada has the capacity that we have for whole genome sequencing. They go through that process. And where there are potential clusters, they go through that urgent process, but essentially they go through right away that process, and then there's a turnaround. And we identify that at the individual level, which is the important thing. What we're going to start to do, because there's a demand for this clearly, Moira, in the media, and I think from the public as well, is to provide that in our daily updates of cases. And so yesterday it was provided, and you're going to see that provided in future in our daily updates so that you don't have to ask the question. So it's not an issue of there being a lag at all. It's just the overall reporting across health authorities centrally, and then providing that information to the public. And I've heard you that you want that every day, and we're going to provide that every day.
Moira, do you have a follow-up?
Thank you, Minister. I appreciate that. However, you didn't answer my question about from the moment of the positive test, how long does the genomic sequencing take to then show up in the daily case counts? And also, you said there may be updated health orders coming soon. What's on the table, or where can British Columbians expect to see measures targeted in the coming days?
Well, with respect, I think I answered the question that when people test positive, they're in the COVID numbers. And we've been providing numbers on variants of concern on a weekly basis. And with respect to Omicron, because of the interest, we're going to start providing them on a daily basis. But essentially, every positive test is now goes through whole genomic sequencing. The turnaround is fairly rapid. And what we'll maybe try and do is with some of the experts who do that, maybe give you some insight into that process, or perhaps with a pool camera or other means to show people what happens, what that process is. I think it's really important to demystify this, and also to recognize the exceptional work of the BC CDC in providing this to British Columbians. It's truly a remarkable thing. Turnaround's quick, but remember, for the individual involved, that's not the important question. The individual involved, it's the test positive for COVID-19, and that's reported as it is regularly. So we report yesterday's numbers today, and tomorrow's numbers, and today's numbers tomorrow.
We have time for one more question. We'll go to Liam Britton, CBC.
Well, hi. Thanks for taking my question. And if we can get answers to these questions in English and French. First of all, Ontario is tracking the R value for Omicron infections, currently sitting around 4. Yesterday's presser didn't make mention of the R value. Are we currently tracking that for Omicron specifically in BC, and why or why not?
The reason is that, so what we provided yesterday, and you saw that, is I think that the RT in BC was 1.02 across the province. It was under 1 in Fraser Health and Northern Health, I think over 1 in the other 3 health authorities. And you see a little bit of that trajectory reflected in the case counts in Vancouver Coastal Health. So for the R number to become statistically significant, I mean, you can provide it. To become statistically significant, you need a lot more cases than 44. I think that's the short answer. And that's why we provide the R number for COVID-19. I want to say this. The Delta variant, for people who are unvaccinated, has proven to be vicious. And so, well, the Omicron variant of concern is of concern. You're not going to get any kind of reasonable, there's nothing to analyze yet in terms of the Omicron variant of concern in terms of an R number yet. It would be so highly variable that it wouldn't be useful information. But the information that was provided is very useful. It tells us where the R number was yesterday. But we're obviously seeing, especially on Vancouver Island, and especially in Vancouver Coastal Health, an upward trajectory in test positivity across all variants of concern, and that's reflected in the R number, and certainly was reflected in the case counts today. Je dirais que l'RT, le taux de reproduction du COVID-19, c'est un nombre, hier c'était de l'ordre de 1,02 partout dans la province, un peu plus élevé sur l'île de Vancouver, à Vancouver Coastal Health et au registre de santé de l'intérieur, moins élevé dans le nord, heureusement, et dans la registre de santé de Fraser Health. Et donc, on voit cela. Donc, il y a assez d'informations, assez de cas pour produire un nombre de RT qui est légitime, n'est-ce pas? Et donc, c'est cela qu'on a donné. On ne peut pas vraiment utiliser cette technique pour ce nombre avec seulement 44 cas. It's the same thing in Ontario. What they're, I think, trying to evoke with that in Ontario is how fast it's growing in Ontario. And 30% of the cases when it was 0 2 weeks ago is a very fast-growing circumstance there. And as I understand it from their briefings today, it's soon to become the dominant variant of concern. So you don't need an R number to know it's growing rapidly, and it is here in BC as well. Not as fast, but fast enough.
And Liam, do you have a follow-up?
Yes, I do. And again, in English and French, please. For people who aren't traveling abroad for the holidays, can they expect their holiday plans in BC to remain intact until the new year? Can we say for sure that private gatherings will not be impacted by any coming health recommendations? Will there be restrictions on traveling between health authorities or from visitors from different households?
You know, the decision to bring in health measures is taken, of course, very seriously by the provincial health officer and by regional medical health officers of health across our province, who are all outstanding leaders, and they understand the consequences of it, and we all do. We all do. Let's face it. Last Christmas and last holiday season and last Hanukkah and last New Year's Eve was profoundly affected by COVID-19. And the last thing anyone wants to hear is that this Christmas and this Hanukkah come by, and this just happened, and this New Year's Eve, and all of the events around it, and New Year's Day, and all of the events around it, and all the different significant holidays are going to be affected by it. No one wants to hear that. But I think we just have to be frank about it, and Dr. Henry was yesterday, that people have to exercise caution. And so the federal government has been clear and given its strong counsel that unless it's necessary not to travel internationally. I'm telling you that the Omicron variant of concern is soon to become, and we see changing health orders in other jurisdictions, the major variant of concern, the dominant variant of concern in the province of Ontario, that numbers are growing here in BC. And so people need to be cautious and prudent when they travel and be respectful of the places they travel to. And we need to do that this year, whether we're traveling internationally, nationally, or within BC. And we say that knowing how challenging this is for people, that this is the time of year, and especially after this year that we've had. And in healthcare, that includes hundreds of long-term care residents who are still living away from their homes, all of whom have significant health issues, living away from their homes because of the recent floods and landslides. And so this has been a tough year, and so I understand, and we want to be with the ones we love at Christmas, and I understand. But we have to be prudent, and that means I would suggest to people that instead of going to parties where they don't know people, that they keep it close, they keep it with the ones that are vaccinated, and if they're not vaccinated, I can tell you, don't travel at all. En français, excusez-moi, je veux dire en français. Je veux dire, mon conseil est le même. C'est très difficile. On sait que tout le monde dans la province a souffert beaucoup l'année dernière. Et personne ne voulait qu'il y ait une situation pareille cette année. Or, dans le monde, il y a cette vérité de COVID-19, de l'Omicron, qui commence à avoir son influence dans notre pays et un peu partout dans le monde. Donc, il faut être prudent. Donc, mon conseil pour tout le monde, c'est de rester conscient de cela, de ne pas participer aux événements qui ont un risque, qui ne sont pas organisés, où on ne connaît pas des gens, où on ne sait pas si des gens sont vaccinés ou pas à un événement, de rester prudent. Et c'est mon conseil. Il y aura, bien entendu, des changements, et je pense, dans des conseils et des règles de la santé publique dans les semaines à venir, parce qu'il faut répondre pour protéger les gens et pour célébrer d'une manière où les gens sont aussi protégés que possible. Et c'est ce que nous allons faire en Colombie-Britannique, et on va avoir plus de dire sur cela dans les jours à venir. Merci beaucoup. Thank you.